I believe that clinical medicine and public health are a continuum. They're not two separate worlds. You're looking at the needs of a specific patient and trying our best to address those needs with as much competence as possible. So you recognize that the whole health system has to be really strengthened. So I would say the solution would be people-partnered public health and digitally enabled, decentralized decision-making at the district level.
Welcome to the season 3 of Policy Talks. We have with us a very, very eminent guest today, Dr. K. Srinath Reddy. Dr. Reddy, welcome to Policy Talks at ISB.
Pleased to be here with you.
Dr. Reddy is an eminent cardiologist of the country. Dr. Reddy currently is the visiting distinguished faculty at the Public Health Foundation of India and the former president of the organization. Being a part of the expert committees of Government of India, Dr. Reddy is a delight to have for the policy talks at the Indian School of Business.
Thank you very much.
What you have brought in terms of your experience to the public policy domain, especially the health and nutrition policy of the country, is truly commendable. But I would like to begin with your early years as a cardiologist. And, how were those years and as a doctor, and how did you move forward to the public health part of it?
Well, when we are practicing as an individual doctor, even though you're part of a large system, you're looking at the needs of a specific patient and trying our best to address those needs with as much competence as possible. But we also recognize that you have to relate to that person and the family beyond that of a purely technical care provider. You have to find out what caused the illness, what are the conditions that predisposed to this illness happening. Was it recognized well in time? Was the person referred to a tertiary care institution like All India Institute well in time before things had advanced to a very severe condition? And if the quality of services in primary care and secondary care were adequate or not. And after treatment, when they return back to primary care or to their home setting, will supportive services be available for continued service provision? So you recognize that the whole health system has to be really strengthened. But you also recognize that there are other elements that determine health and illness. I mean, if it's easy to say that an auto rickshaw driver came in with a heart attack because he is a smoker. But what made the person take up smoking? What were the pressures on that? And also, how did it happen that nobody educated him about the harmful effects of smoking? So these are important issues that we have to raise, and that brings us into the public health dimension as well.
Right.
So I believe that clinical medicine and public health are a continuum. They're not two separate worlds.
True.
So that's how I believe that I was led into the public health domain.
You just mentioned, Dr. Reddy, of the usage of tobacco, and you've been working extensively for that. What would you recommend to our listeners as a message? While we know it, but if it comes from you, I think people will take it all the more seriously.
Tobacco in any form is harmful to health. But the important thing is to try and control the tobacco consumption by a variety of public policy measures. Taxation is the most important measure. Telling people about the harmful effects of tobacco in terms of health education is important. Good warnings on the tobacco packages are important. Health warnings, particularly pictorial health warnings.
True.
Smoke-free public places and workplaces are important. And helping people with cessation attempts, that's also going to be very important. So there are a number of measures in tobacco control that we need to take.
Dr. Reddy, you've been a part of expert committees looking at public health, ensuring health for all. What do you think has to be the vision of the country while, we are already 75 years of independent country?
When we talk about their health, we're talking about multiple determinants of health, not just health services. We're talking about nutrition, right from their mother's pregnancy to early childhood to adolescence to later on, the kind of foods that they will have. And secondly, we also must ensure that their exposure to pollution is very limited. That means we must clean up our air. We must create cities which are much more favorable to pleasurable and safe physical activity. So, in a sense, we have to create an environment in which our people can grow up healthy. So, we need to enable people to protect, preserve, and promote their own health.
You also have been speaking a lot on the health assurance in particular, not insurance. Could you please let our audience and our listeners know about this concept of health assurance and what all does this include?
Well, when we want to create a healthy society where every person is assured of good health to the extent possible across a whole long life course, but when they do fall ill, as some of them will, at some point in time, we also need services to restore their health. Now, all of that requires not just health services, which are focused on these, but beyond that, we also need to ensure that our social determinants of health and environmental determinants of health are appropriately configured to be better aligned with health priorities, and that the commercial determinants of health are not eroding health. So those are the actions that we must take in the public policy sphere. And for a service to be delivered efficiently under universal health coverage, we need a multi-layered, multi-skilled health workforce.
Right.
We need adequate health financing, preferably public financing from taxes, supplemented by some forms of social and private insurance, but that cannot be the mainstay. We also need assurance of availability and affordability of essential drugs, vaccines, and equipment.
Right.
And then we also require reliable health information systems. We need to know what's happening to formulate our policies and to monitor our programs. So we need good data systems.
True.
And we need very effective community engagement and participation. I mean, you may have different ministries dealing with different issues, different joint secretaries dealing with different issues. But in a family, they're dealing with food, they're dealing with water, they're dealing with electricity, they're dealing with illness, they're dealing with medicines, they're dealing with everything. So that is multisectorality. So both at the highest level and at the ground level, you need to bring that coalescence.
Wow, amazing. I think that holistic approach is what is required in the coming times. My last question to you is relating to the challenges that have been coming recently. We've been talking about climate change. How do you think we can overcome the challenges, we can accept and look forward to the opportunities that are coming in the health sector in particular?
Well, climate change requires solutions at multiple levels, and we cannot delay action.
True.
And we need to treat it as an absolute emergency and initiate all the actions both for mitigation and for adaptation. Particularly in India, we're going to be very vulnerable, even if we are not contributing much per capita to greenhouse gases. We are going to be one of the principal victims of climate change. So while we must be really advocating vigorously for mitigation at the global level, we must also be prepared for adaptation by preparing climate resilient and climate smart health systems as well as food systems,
right,
and make sure that our people can bear up to the coming changes without suffering too much. So I would say the solution would be people-partnered public health and digitally enabled decentralized decision-making at the district level.
So thank you, Dr. Reddy. It's been wonderful having this conversation with you, and I'm sure our audience are going to be delighted with this conversation. Thank you so much.
Thank you very much for the opportunity.